gums and teeth along with your own so they don't get cavities when they're getting older. Basically, to brush your baby's teeth, once they're around the age of 1 or even 6 months, when their teeth start coming in, you're going to want to lay them down onto the floor or onto a bed or something, and you want to, while they're laying down, you're going to want to brush their teeth. And you're going to do this every morning and every night. After the age of 2, as they get a little bigger, you can just sit them like in front of a mirror and stand behind them and kind of guide them with the toothbrush to brush their teeth. And if they're under 6 months and they don't have their teeth yet, just after breastfeeding or bottle feeding, if you just want to wipe their gums with a gauze pad to get off all that milk and plaque that could build up there.
And after they get their baby teeth, use an actual toothbrush. Make sure you angle it towards the gum line so that you get the plaque, because this is where you're going to get most of your cavities, up where the gum meets the toothbrush. Just got quiet. So you want to make sure you do it twice a day. Make sure you do it with your baby watching you so that they understand it's a good thing to do and that it's the big girl thing or big boy thing to do. And these are other aids to help remove plaque. They have electric toothbrushes for kids. I think they're like $15. They have adult ones. Those are really fast, bringing off more plaque and reduce cavities. These are little flossers for kids. They're a lot easier to get in instead of actual floss. And then this is just an anti-cavity mouthwash that'll help reduce caries rate.
Okay, and also I didn't mention, if your child is under the age of 2, do not use toothpaste. You don't want to use toothpaste on your child until they're able to actually spit out the toothpaste, because the toothpaste has fluoride in it, and you don't want your child to swallow that. So you can use either unfluoridated toothpaste or just water on your child if they're under the age of 2. If you take away anything from today, do not put your child to bed with a bottle or juice. Baby bottle decay is very common if you put your child to bed with that, because the sugar just collects on their teeth at night and it completely rots away their teeth and destroys it. If you have to put your baby to bed with a bottle, put water in it. After the age of 1, they shouldn't be drinking out of a bottle anymore anyway. They need to move to a sippy cup. Fruit drinks, if they're 100% fruit drinks, are good. Don't steer away from like Kool-Aid and kind of more sugary Capri Suns and drinks like that, because those are very sugary and can cause cavities. 52% of children 2 to 9 years of age have cavities, and it's completely avoidable just with proper brushing and proper nutrition. Avoid sticky candy snacks. They're good in moderation, just obviously not all the time. And if you're going to have like a sugary snack, eat it with a meal, because the rest of the food and drink kind of rinses that out of the mouth. Don't eat it in between meals where it'll stay on their teeth all day long.
It's true. Next is teething interruption dates. Baby's teeth starts coming in about 6 months. They start down the bottom, and then they'll come in at the top. As soon as they start coming in, you really need to start brushing them. Whenever they do start having teething, they're going to get a little bit of a temperature. As long as it's under 100 degrees, that's fine. They're going to be putting things in their mouth, and then also really fussy. So just make sure you watch out for symptoms. Don't forget to get them. And this kind of shows what's going to happen. In about a year, they're still getting their teeth. By 3 years, they should have all their baby teeth. And by 6 years, they're going to start losing those baby teeth. And by 10 years, they should start having mixed baby teeth and adult teeth. This kind of shows the adult teeth coming in behind the baby teeth. So if you're having cavities in your baby teeth, you need to watch out, because that can transfer to your adult teeth.
Okay, so basically around 6 months is when your child's going to start teething and get those first teeth down here on the bottom. You want to take your child to the dentist for the first time when they first start developing their teeth, or around the age of 1 year is their first dental appointment. After that, you're going to take them every 6 months, just kind of for an overall checkup. Ask your dentist about sealants. At the age of 6, your child is good for sealants, which basically 6 years of age is when those back molars start coming in, and those molars have a lot of cracks and pits and fissures in them that food gets stuck down in, causes the decay, the cavities that you don't want. A sealant is basically just a plastic covering they put over the tooth. It's painless, it's not invasive at all, and that just prevents food from getting stuck down in there. A sealant lasts for about a year or 2.
And it's 100% preventable for decay. And then fluoride, we need to watch out for babies up to age 6. We need fluoride that goes into their system, so tap water that has fluoride in it. It's going to keep both their bones and their teeth healthy and strong. It kind of mineralizes the enamel, different part of your tooth. And then after they turn 6 and up, when they get teeth in, you need to start doing topical, so fluoridated toothpaste. It's in almost all toothpaste now, I think. fluoridated mouthwash, as we talked about. That's going to help keep them mineralized and healthy. And that is all.
That is it. We have toothbrushes, you guys can take on.
Any questions?
My son's still on the bottle. He's one. And he goes to sleep with the bottle. But he doesn't always have it in his mouth.
It's still that in milk there's sugars, and that sugar sits on the teeth. See how it's kind of right in the front here? That's where it sits, and once it sits there, it can decay right there. And it's really important that that sugar gets off, because once that decay occurs, you can't save the tooth very well. You're going to have to put restoratives on it or fill it, and it's really painful for a baby. Besides the cost of it, you know, it's painful. It's going to hurt them to eat. So we want to make sure we use water instead of
Definitely do not. He won't drink water. You might just need to try to just start weaning him off from doing that. Because do not put him to bed with juice or milk, because it will cause the decay. And at 1, I mean, it's okay to still be using a bottle at 1, but if you try to start moving him towards the sippy cup at that time, that'd probably be good too. And milk during the day and juices during the day is fine. Again, make sure they're like 100% fruit juices, not so much of that Kool-Aid sugary stuff that's going to get all over their teeth. It's not at bed, because that's when it sits on their teeth all night and just kind of rots them away.
Yeah.
Any other questions?
Alright, well, thank you all for your time. I know it's precious.
You'll be able to use that for a good 6 months. We're already done. That's presentation.
Oh, okay. I tried to leave, that was
Big boy toothbrush, they're a little bigger. It's not a different little one. Maybe they're little ones.
They didn't say no.
Thank you.
Where you get a smartphone your little last day? You so warm?
No. I'm freezing. It's almost here.
Ooh, cold.